From News 8, this is Live Desk Conversations with digital anchor Luke Laster.
Good morning, ladies and gentlemen. My name is Luke Laster here from the Wood TV Live Desk. Another Live Desk Conversations here as we get rolling. Christy Buck joining us this morning, Executive Director and founder of Be Nice, the Mental Health Foundation of West Michigan. Christy, how are you this morning?
I'm doing great. Thank you so much. It's sunny out, so why not?
Absolutely.
Yep.
So Christy, real quick before we get rolling here, could you just tell us a little bit about your background?
So my background is more than 34 years working in mental health. I did direct care, and then about 23 years ago, I was given the opportunity to lead the Mental Health Foundation. And over the past 15 years, we have dedicated our mission and our drive to bring mental health education, suicide prevention education to schools, in addition, businesses, faith communities in general.
And that is our topic of discussion today, is mental health on a broad spectrum. Before we dive in here, folks, I do want to say, if you see that hashtag there next to my name, says hashtag Hey Luke, use that hashtag in our feed here on Facebook. And if you have any questions or anything along those lines, I'm able to see it. And again, if it's relevant to the conversation, I can put it up on the screen and we could get that answered. So let's dive in here and kind of go from the top down. I want to start with elderly people. Obviously, this has been a very tough year for them, those in nursing homes and those who live in residential homes as well. We're at the point now where we're reintegrating back into society. Elderly folks are getting vaccinated at a very rapid rate. Let's talk about having those conversations with your parents, your grandparents, first, who might be in the nursing homes.
It all starts with noticing and recognizing a change in what they are typically like. And those are changes in their thoughts, their actions, and feelings. And that could be, from physical changes to behavioral changes to psychological changes. And what we're looking for is what is different from what they are typically like. So am I looking for more sadness, more crying spells, withdrawing within themselves, not participating in conversations with family members, more conversations about life not being worth living. And a lot of what happened in COVID and during this pandemic brought about a lot of those changes. The worry, concern that I'm never going to see my family again, the worry, concern that I'm going to die, the worry and concern, like we all have, that I won't see and be with my family ever again. So, as we're moving forward, I'm going to encourage people to look for changes in what is typically going on in their behaviors. I know that facilities, residential facilities, assisted living facilities have tried their hardest to connect their loved ones with family members, right? Well, the residents of their facilities, but that has been difficult. So consistently, the conversations to have with our loved ones is reassurance and giving them hope that when we are through the pandemic, we will go back to the way things were. I think that we have to lend hope to anybody in this situation right now. And I'll be honest with you, Luke, that's oftentimes what people lose, what brings about that change in their behavior, the lack of hope.
And keeping that up, that even expands past elderly people as well. You could mention that with children or high school students, which we'll dive into in a moment, but keeping that message of hope across the board, kind of how would you, I guess, let's hop into that conversation about children and stuff as well. Yeah. How would you translate that?
With kids, and oftentimes with anybody who might be struggling with anxiety, the feeling of hopelessness, like we're never going to get through this. This is just taking a whole year of my life. It's concentrating on one day at a time. And taking these days and working with our kids to recognize the good that happened in this one day, and not to look so far forward, but to keep focused on what I am in control of right now. And most definitely what has transpired is that we keep looking down the way, way down. Whereas if I am dealing with things that I cannot be in control of, and those are things down the path, down the way, then I need to back up, and focus on what am I in control of right now. What I'm in control of is basic things: eating right, getting enough sleep, exercising. Those I can be in control of. And all of those things, Luke, those help our mental health. Same things that can help my physical health. In addition, what are the things am I in control of? I'm in control of communicating with people. I'm in control of making sure that I can recognize how I can communicate with people still. I am in control of whether or not I interact with family members. Again, so focusing on what I can control. And then those other things that I'm not in control of, I'm setting goals as to when we come out of this and when we are back to where we're gathering as a family, what can we look forward to then? What are some great things we can look forward to?
You know, another thing that I think goes kind of across the board is consumption on social media, and especially with children, with what they are exposed to nowadays. In terms of the things that we can't control, limiting that time, you know, any tips on things like that for parents to be like, especially when you're not going out as much, you know, keeping the kids off the iPad, keeping the kids off the laptop, things like that.
Right. So I want to encourage parents, you know, it's hard, but you need to know every site that your child is participating on. We'll say it that way. Have passwords, have the ability that you are connected to them via these networks. And I'll be honest with you that a lot of times, we don't even know what some of the apps are. So at the beginning, when TikTok first came out, people were very concerned about the harassment and the bullying that can happen on that platform itself. A lot of parents weren't even realizing what the heck is TikTok. So becoming knowledgeable about what different social media sites my child has access for, Google it, look it up and read about it. And find out then, how can I put into place some of the security measures, right? Secure as to who can be on that with my child, with my son, daughter. In addition, limit the time on social media. You know, give them a blanket, give them okay, you can be on it from 2 to 3, whatever, 3 to 4 in the afternoon, whatever it may be. Have a time then where you're limiting them. And then there's a spot in the house where all devices go. A collection of devices for the rest of the night. I'll be honest with you, a lot of things that happen on social media that can have an effect on someone's mental health, how they're thinking, acting, and feeling, are those late night hours. So not allowing our kids, our teens, to have devices at their access during the night. I can't stress enough how important sleep is to the mind. And that is from a small child to an older adult. We've got to get to that REM point where I am deep sleeping and I'm getting a rest for my brain. That's a huge part of social media. You know, Luke, social media has been good in ways also. And that is the ability to connect, to laugh, to have fun, but it comes with limits, and it comes with making sure that I'm monitoring what my child is doing on that device. There's a rise in suicide, I'll just be honest with you, amongst 10 to 34-year-olds. A 10-year-old is approximately, I'm going to put it probably 4th or 5th grade. And how can that be, people say? Well, much of it, again, can happen via social media. So if I have this little iPod, I don't necessarily have an iPhone, but I have this device to connect, how I'm being treated can sometimes bring about thoughts and changes in my mental health. What I'm not being invited to, or I'm not connecting, that can have an effect on my mental health. So if I'm going to provide my child, my teen, with the ability to have access, then I need to also, again, right, be familiar with those sites that my child is accessing.
And Christy, we do have a question here. I'm posting that right now, so that's popping up on the screen. This one from Jessica. It says, hey Luke, what are some signs or symptoms I can look for as a parent that could be a change in mental health or a mental health concern?
Sure. So again, I'm going to say that it comes physically, behaviorally, psychologically. So physically, I'm looking for fatigue. I'm looking at weight loss, weight gain. Is my child, my teen experiencing headaches? Are they experiencing unexplained aches and pains? All right, so what I would typically do with those, I would take them to the doctor. All right, but I also want to make sure that my pediatrician, my physician is asking the right questions to my son or daughter. And then also that I'm asking the right questions too. What's been changing? In addition, behaviorally, crying spells, withdrawing from family, spending more time in their bedroom, isolating themselves, spending more time on personal devices, personal appearance. Is my son, daughter taking care of those basic needs of hygiene? I will be honest with you, this is one of the first and foremost. My child just isn't looking the same, okay? And it's not just because we're home and we might not be getting dressed because all of a sudden I'm hybrid and virtual again. I want to know, I want to ask my son, daughter, why are you aren't showering? You typically shower all the time. I'm noticing these changes, right? Loss of motivation. A huge one this year, Luke, I cannot stress enough, is when kids have been dropping out of the things they love. Finding a way for my son, daughter to keep connected. So because of the shutdown, right, going hybrid, going virtual, going back to school, a lot of groups and organizations did continue because school districts see this as important. So just because it changed to a different way, I'm going to be the cheerleader and the encourager for my son, daughter to stay connected to their school in some way. In addition, psychologically, have conversations with my son, daughter changed? Are they talking more about no purpose in my life? I feel like a waste of a human being. My grades have dropped. There's no way out. I'm not going to get into college. I might as well quit things. These conversations, Luke, are really serious. Those conversations, what are they full of? They're full of no hope, worthlessness, a feeling of hopelessness. I need to be listening for those conversations that my child is saying. And if indeed those things are things that I'm noticing, I'm seeing, I'm hearing, right? I'm using all my senses to observe. Then I need to move into the next step of the Be Nice action plan. Those are those notice. I got to invite myself to have an open conversation with my teen, with my adolescent, with my child.
Jessica, thank you. And Christy, thank you for answering that question. Going to unpublish that one now. I want to talk about the very specifics of between teens and children of kind of just the differences in talking to them and more importantly getting them to talk to you as a parent. What are some of those kind of nitpicky things of like, okay, I'm talking to my 10-year-old as opposed to talking to my 17-year-old?
Yep. Well, I'm talking all the time about mental health. So at a very young age, conversations surrounding mental health need to be started. All right. And mental health is really basic. That is how you're thinking, how you're acting, and how you're feeling. All right. And if I can have simple conversations like that with my son, daughter, and I am noticing some of these signs and symptoms, then I want to start a conversation with my 10-year-old surrounding what is going on. I am noticing that you don't want to take a shower anymore. What's happening? How are you feeling? Well, I just don't feel like getting up. There's no point in me taking a shower. Nobody's going to see me anyway. Well, you know what? That would make you help you feel better. I know when I take a shower, it starts my day off in a great way. So I'm starting real basic conversations, Luke, but I also am hitting mental health, thoughts, actions, and feelings. In addition, if my 10-year-old, 11, 12-year-old said to me, there's just no purpose in my life anymore, I may as well be dead, then you better believe I'm going to have a straight conversation with them. And this is with any child. Okay, what you said just now is you may as well be dead. I'm going to go a little bit further with you because I love you so much. What do you mean by that? Well, there's no point in me living anymore. Okay, let's talk a little bit further. Those are some serious conversations that we're having right now. And when you say that, it worries me to the point to ask you, are you thinking about killing yourself? Now, why would I say that? Because I want my son, daughter to tell me if they were thinking that way. Well, no, Mom, I was just saying that. I'm just passing it by just because I said it. Well, I'm glad you are, but you know what? Whenever we have conversations like this, I'm going to be asking you these things because my life would never be the same without you. Oh, Mom, don't be so dramatic. I'm not being dramatic. I'm going to be making sure that you and I are always talking about these things. And I want you to know that you can talk to me. Now, Luke, was that easy? That was a real simple conversation. And this is how intentional and serious we need to take mental health, that we need to take the onset of a mental health disorder. And those are those changes in behavior. And then ultimately, good, straightforward conversation about what I'm picking up in a conversation from my child. All right, moving forward with teens, very, very similar, real straightforward. Hey, I'm noticing I'm really worried about you. You came to me last week and you're going to quit the soccer team. This is really serious because soccer has always been the number one thing with you. I want to talk to you. Why do you want to quit the soccer team? Because there's no point. What's the point? We're not going to play again. We're not playing now. I was quarantined for 2 weeks in the fall for my soccer team. I know, but you know what? That is a way that connects you to your friends, to your family. What are you going to do differently at school if you're not going to do soccer? I'm worried about you because you've always been someone connected to your school. Okay, what I did now was I'm recognizing that my son, daughter doesn't want to do something they typically love, right? And I'm going forward to say, now what are you going to do? What are you going to get connected with now? All right. In addition, when I'm having these conversations with my son, daughter, I don't want to look for the yes and no answers. I want to look for it further. So when I'm asking them, I'm not going to say, are you going to get involved with something else? Well, no, or yes. Okay, that doesn't tell me anything. Okay, what are you going to get involved in? Are you going to do a different sport? Are you going to do theater? Are you going to do a club? Now, these are real basics. Okay, but those other conversations, Luke, just like I said a moment ago, if I'm picking up on a conversation with my son, daughter, where they're talking more about, I might as well be dead. Y'all would be better off without me anymore. I'm just not even a good kid. I let everybody down with everything I do. If I were gone, I wouldn't be another expense in your life. I mean, there's so many things that go on in adolescents and teens' minds of how they bring so much bad stuff, negativity to the table of being a son, daughter, right? So those conversations need follow-up. And those are great conversations that I love them because it can help you to get to know your son, daughter so much better at this different level of thoughts, actions, and feelings. So picking up on those tips. You said right now that you're a burden to our family. What makes you think that you're a burden to the family? You're not a burden to the family. We love you so much. No, just now my kid said to me, I'm a burden to the family. Whoa. Why do you think you're a burden to the family? Well, just because I'm not doing anything. I'm just terrible. I'm in bed all the time. I can't get up. I'm lazy. Whoa. Those are big things that you're talking to me about right now. Saying that you're lazy. What do you mean by lazy? So all of a sudden, you don't even have to be a social worker to pick up these tips of how to have these conversations that what my kid is saying is like big stuff. These are deep things where my kid is seeing themselves as lazy because they can't get out of bed in the morning. That also is a symptom of possibly depression.
You know, we've hit on elderly folks. We've just chatted about children and teenagers. Mm-hmm. Something that kind of goes under the radar. What about that person, that parent dealing with that? You know, say you're managing stress of your mother or your father in a nursing home during quarantine, during COVID times. Maybe they just got their vaccine. You have children who may be struggling with some form of depression. Mm-hmm. What about yourself? You know, you still have to look in the mirror at the end of the day, managing that stress, things along those lines. What about self-help?
You got it. And so we know some risk factors for depression are stress, ongoing stress, All right. So let's think about that right now in our lives, stress and ongoing stress. And now we're talking adults. All right. You've got financial, you've got possibly death of a loved one, you've got the inability to see loved ones, right? And I'm only stressing these again to our audience today because those are huge things to see within myself as to why those might bring about a change in my behavior. Okay. So I'm looking at these stress. I'm looking at all these things that are coming my way, different job, the way I'm functioning, the way I'm doing my job, the way I'm working with coworkers, the way I'm supervising, the way I'm being supervised, my kids, how I'm managing, all of these things. This is what we're talking about. But what I have to do is I have to recognize at what point are those things bringing about a change in my behavior, bringing about a change for 2 weeks or longer, such as now I'm isolating myself. I'm angry. I'm afraid. I'm having panic attacks. I'm drinking more. I'm maybe participating in drugs. There's so many things right now that I need to look in the mirror and say, all right, this is bigger than what I thought. Okay. I'm going to re-stress this. Changes in my behaviors for 2 weeks or longer might warrant for me to reach out and have a conversation with my doctor. Okay. It could be sitting down with a family member, talking about these changes. It may take me as a spouse, Luke, if I see these changes in my husband, all right, pointing that out. You are so much more angry than you were before. What is going on? I want to work through this. So I'm going to go through the action plan because I love it so much, Luke. I'm noticing these changes in this person's behavior that's typical. All right. I'm a true believer, and there are some really great things that I can put into my life to help my brain think better. And these, I'm going to repeat them, are getting exercise, eating well, getting good sleep habits, cutting down on alcohol intake. All right. This is huge right now, enormous. The amount of alcohol sales that went up. I heard someone say, oh, well, that's because bars were down. Okay. Don't go there with me when I work in this field. All right. We know it, that people self-medicate. Okay. So I got to look at those things. I want to also, practice some things like mindfulness. I want to get up in the morning, possibly pop in front of a mirror and do some positive self-talk. A lot of people use faith and spirituality. That could be called meditation, and it could be called straight up praying. But those are these things that can help build mental resiliency. But I'll be honest with you, Luke, if those things are not helping to change, then that may be where I need to do a reach out call to possibly my physician, possibly to my insurance provider to find out where are some clinicians that I can get some help. We do at the Mental Health Foundation we don't do clinical work, but we often will recommend clinicians. We've got a place on our website that's Get Help. I encourage people to click on that. A lot of folks have, through their jobs, they have something called an employee assistance program. Rock solid, awesome benefit that people sometimes don't realize they have. And those folks can provide you with 6 to 8 sessions of counseling that, you know what, that can be all I might need. And that may be those things that are building that confidence in myself again, right? To build some resiliency in myself.
As we wrap up here, I want to talk about the future. Is there any fear of, especially with children, who, have kind of had, well, we've all had our worlds flipped, but for children who can't quite comprehend the mask wearing, things along those lines, any kind of, for lack of a better word, PTSD with that, 6 months, a year, 18 months down the line?
Yeah. So PTSD is obviously post-traumatic stress disorder. And as we're following this up, I need to, again, realize what are the signs and symptoms for this. Very similar to depression. I went through a lot of those, right? Physical, behavioral, and psychological. I want to make sure that I am aware for any of these changes in someone's behavior. And if I am seeing these changes in someone's behavior, following everything that's going on, I want to make sure that I am connecting and contacting my physician to get a good old appointment with them to make sure that I am not missing something. I want to possibly connect with a counselor, maybe what you want to start with at your school district, to say, hey, I've been noticing these changes. I just want to, as a parent, be aware and be on top of what's typical of my child and what has changed within my child. But we know during a pandemic and epidemics, research has shown an increase in the rate of suicide. So I'm a believer that there may be an increase in anxiety, depression, post-traumatic stress disorder. And get this, if I can recognize the onset, I am going to help to reduce those numbers. And I am going to make this epidemic and pandemic unlike any other one, because I'm going to be paying attention.
Christy, I really appreciate your time today. Anything else that you'd like to add here?
No, I hope everybody's getting the passion that I have for this. But, I love it. I see so much hope. I do see that that the silver lining has been that maybe this has brought us closer to our loved ones, and maybe this has increased the ability to spend more time with my family. I know that did it for me. It also brought a lot of stress. I know right now I need a vacation, and I'm pumped up. I'm counting down the hours right now, but I want people to go to our website, Luke, benice.org, and take the pledge.
Nice. Christy Buck, thank you very much. I'm going to ask you to hold on for a second before you hop off the call. I'm going to wrap up the stream here. Folks, we're going to have this up on woodtv.com for you to view. We will update that here just as soon as I get off this stream. Again, you'll be able to view this under the video tab over on our Facebook page as well. This has been a look at the Wood TV Live Desk for another Live Desk Conversations with Christy Buck. I'm digital anchor Luke Laster. Have a great afternoon, folks.